Health. Let's talk about your health. What determines your health in the end of the day? Surprisingly, the main aspect of determining your health is for 20% your genetic profile. We can't do anything about that yet. Then we got almost 20% based on where you were born, your postcode. In the Netherlands, there are cities where it matters 9 years of life expectancy whether or not you were born in that particular city or not. And then we got like 40% your behavior. What do you eat? Do you work out? All those things joined together, and then the combination of that. There's something missing in this graph. Can you imagine what that is? Actually, it's healthcare. And the reason for that is that healthcare only for 6% determines your health. And the interesting fact is that in that 6%, 90% of the budget goes into that bucket. And that's our problem. That's what I like to call also our plumber's problem. Whereas in healthcare, we wait until the moment in time when something gets wrong with your health, and then we start to fix it, kind of making sure we plaster the walls or fixing the pipe. Well, the reality should be that somebody should go into the basement and to close down the tap a bit more. The other thing that is off is that we're facing a doubling in healthcare demand over the course of the next 15 to 20 years. A shortage of skilled personnel that if we don't do anything now, that also almost will double in the course of the next 15 years. One of the reasons, for instance, why nurses quit their job in healthcare is that at this moment, they already have 40% administrative burden on a daily basis. That's 40% not being able to collaborate and to work with their patient, but entering data in systems. We also see a decrease of the number of people wanting to work in healthcare, so the influx is getting less by the year. Combined with budget pressure and patients getting more and more well-informed, gives us a tremendous challenge. Whereas one could assert if the way that we approach it now, in terms of trying to get it a bit better, a bit cheaper, and a bit faster, is the right pathway to go into. And I would argue that that is the wrong pathway to go into. I think we need to have a broader look, not only into the patient journey, because the patient journey merely is nothing more than a journey of a patient in one institution and also often only at one ward or one physician. Where the actual patient journey, as Annemiek Vroom from the Foundation Icona always states, the journey of life is the most important part. Or to put it like Sarah Rigare from Sweden, a patient with Parkinson, in her PhD dissertation states that the 1 hour that she visits her Parkinson neurologist is not going to change the other 8,765 hours that she lives in a whole year. And with all the challenges just mentioned, maybe we should try to also take a stance into the rest of society and the stepping stones during that journey of life to indeed influence our health. And that's also where different companies and organizations come to the mix. Retail in the broader definition, like from pharmacy to the supermarket. Pharmacists, as in delivering low complexity healthcare interventions, measurements in the pharmacy. Supermarkets by offering more healthy food at an affordable price. Whereas at the moment, unhealthy food is 40% cheaper than healthy food. From that perspective, getting nudged during that journey of life maybe influences us more than that 1 hour that we visit our physician in the hospital or at the GP's office. The second thing that's happening is that with the use of new technology, we will be able to deliver low complexity healthcare interventions in different places, by different people, in a different moment in time. With that, lowering the pressure on the current healthcare system, because by no means we will be able to cope with those challenges as we face them right now. So the opportunity today is to make sure that we aim more for health as opposed to healthcare. In doing so, ensuring that healthcare stays and becomes affordable and accessible for all with a high quality level of healthcare. But we need to take steps into that. Let's bring somebody into the basement to close that tap a bit more.
So there we have it, the challenge. Thank you very much. Thank you. Thank you for your kindness. So there we have the challenge with the pieces of puzzle that we need to fix in the end. And how are we going to fix these kind of things? If this is the challenge, we basically need to think differently. And this is, of course, a reference to the advertisement campaign of Apple, Think Different. And I would like to encourage all of you today and the next of the 3 days to think different and to step out of the average solution finding aspect. Because sometimes we've kind of fallen in love with the problem, no longer finding solutions. And I actually think we need to get these kind of buildings obsolete. Sorry for that, Helen. But if we're able to make sure that we can help those people in doubling in healthcare demand with more severe problems, that's the reality that we need to face for. Because the technology is bringing solutions. This was our desktop ways ago, and everything now sits in glasses, in lenses very soon, and if you trust Elon Musk with a connected cable back in the back of your mind very soon as well. Let's talk about battery life. This is the first battery that runs 50 years, 50, without being charged. So technology can come to the rescue. And that's also why I was very proud to see in my own hospital in Roermond to be starting the very first hospital to use self-measurement kiosks, like the one that sits over here, where in the old days a nurse would take my blood pressure and oxygenation level, and now I would just sit on the system, and every patient that visits the outpatient system in our hospital is being measured the blood pressure, standing up with the weight, we kind of blocked that for you guys, by the way, saturation and also temperature, if needed. And the data goes directly into the electronic medical record system. And I'm very proud of that. But why in the hospital? Why not near to the patient? In the supermarket, in the drugstore, in the pharmacist, for instance. And the last thing is happening as we speak. Yesterday, the very first kiosk was placed in one of the major pharmacists in the Netherlands, actually in Limburg, in Venray, at one of the BNU pharmacists. So this is happening during our watch, as you can see. And now the video plays, sorry for that. So that's one of the challenges, to bring technology outside of the clinics where we can save time to treat the more severe patients and also the more patients. One of the other procedures, as we all know, is having your blood taken. We need to go to the hospital or to the GP or some other places. And that is going to change. And I'm now up to my own David Copperfield moment, or Hans Klok if you want to take it like that. And I need to pull this, ta-da! So this is the very first robot that fully by itself draws your blood, without any person sitting next to it. I hope this goes okay. So I will run the video so you can see a bit how this works. So I put my arm into it, of course making my arm a bit free, and then I need to push the start button, and the technology would start. It at first will use its infrared technology to find my veins. At first it will grab my arm, so now I can no longer get away from it. So bear with me. And then it sprays a bit of alcohol to my arm, obviously. With ultrasound, it finds my exact vein. And it depends a bit on the person and how good it can find the right vein to make sure that the next step is being taken. And once the blood has been taken, it also will put a patch on my arm without any intervention of a human in it. So that does the trick. But to be honest, there's no needle in this system. I'm not chickening out, to be honest. But the reason for that is that it isn't able to do these things in a conference center because it needs to be certified with all the bells and the whistles that you need for this. So this new system for Vitestro has been developed. It's a Dutch company, and we have the CEO over here. Toon, could you please join me on stage? Toon. Awesome technology, and everybody thought it was going to happen, but I'm fine with that. I know it does work because this is not something that you're early in the game, isn't it?
No. So we tested.
Can we have the audio for Toon?
So we've tested the technology.
Well, backstage something's happening right now. It's like,
We're checking the mic. Check.
yeah, well, there's a new mic coming up. Yeah.
Check. So is this working?
Okay. Keep speaking. No, there's no audio. So just come stand next to me. So like we're friends.
And just in your microphone.
That's good.
That's how we should do it. Yeah. So we tested the technology in over 3,000 patients in different settings in the Netherlands and other countries.
Hospitals.
Hospitals, yes. Because we see that there's such an incredible shortage on on the phlebotomist and staff, and that's what we also heard in the previous conversations and the speakers. And we're going to solve that problem for phlebotomy.
And how is this going to help hospitals, not only in terms of the shortages? How much of a shortage could you solve for this?
So we can solve the phlebotomy shortages. We're going to try it again?
I still love you. That's fine.
Okay. So yeah, I think this is working. Yeah, so we're gonna. So I think there are a couple of problems in healthcare, right? So first of all, it's the shortage of staff, but secondly, also the standardization, because we want to collect all the data of all the patients, and I think that's also what we're able to do here, because we know which patients we draw blood from. We give that back to the laboratory information system, to the hospital information system, so we can collect all data of all patients, and we can trace that over time.
How long before this sits in the pharmacy?
A couple of years, yeah. So first the focus is to place this in the larger settings, such as the larger hospital phlebotomy departments. But then like making a small model, which you can even maybe put at a pharmacy or at a GP, that's definitely a next step. But we're going to launch this at the end of this year. So the first devices will be commercially available at the OLVG.
You've seen it in Maastricht, just by the way.
Yeah, you've seen it in Maastricht. And the rollout will be next year in several hospitals in the Netherlands and in Denmark.
Yeah, and you've been working on the system for 7 years, right?
We were at 7 years. We built a team because it's such a complex technology. We are with a team of more than 70 people. We built for 7 years on this system to bring it on the market.
Thank you very much. Thank you very much. Toon, thank you. So that's one aspect, but let's think about your toilet visit. Toilet? Yeah, toilet. Because there's a company, 100 Restroom, that's just trying to completely revamp your experience at the toilets. Not only for your bio break, but also let's take a moment in time to relax. Or to take a next step, to have this wellness aspect of it, and take some of your vital signs just in the comfort of a toilet zone. And the first one has been opened in Utrecht, in Hoogkaterijnen, and very soon to a, not to mention the name, design or outlet center near Roermond. So just stay put for that. Again, so I would like to teach you again to think differently in that. And that's also what we've done with the program that we've named Healthcare Meets Retail, where we try to figure out what of the low complexity aspects in healthcare could be outsourced into retail, from supermarket to pharmacist into it. That's where we, together with a lot of partners, 30 in total, many of them are present today over here, we've opened up a pop-up store to just give it a try at one of the high streets in Roermond. Now we're heading for 2 suburban areas and again also to that outlet center. And this was how it looked like. We've done tons of research also in terms of how retail could help, what from a healthcare perspective would be feasible enough, and in the end of the day also to real-life test into it. And we now see that there's a strong convergence between consumerism, which also gets more into the health arena, and also into healthcare as well. Deloitte has run research in 16 countries, 15,000 people into it. And so this new kind of Venn diagram at the convergence of it brings new opportunities like this one, which is basically from my former work with some colleagues of mine in the room as well, where we invented a shopping cart. Just imagine with a system on it, and the moment in time when they get into the alley with the candy, it says, no, I don't think that that's a good idea. And if I'm not convinced at that moment in time, it will shock me, by the way. So we need to rethink. We need to rethink and imagine it from a different perspective, not in these kind of aspects, but for instance, with fall prevention. 50% of all the falls with fatal aspect often is happening in the home. But 50% is happening outside of the home. So why not also try to figure that out? So for that, we have a great session tomorrow, which is also being accompanied by the Dutch Minister of Health, where we try to figure out what can others do, not in the home, to prevent these falls. So we need your creative aspect, so please join us over there. And the last thing that I want to share with you is that we're working on a provincial innovation center broadly. As a matter of fact, yesterday, the board of Maastricht University Medical Center and the board of Laurentius Medical Center agreed that they would start a collaboration between the Innovation Center, the Innovation Lab of Maastricht University, you can find that out here, and the Medical Center in Roermond. We don't know exactly how this will play out, but it's the first step. The next step is that provincial center for that, because if you look into Limburg, you can see some of the Brightland campuses. You can find our friends also over here at the Expo Center, but there's a gap. And I think the gap is in Roermond, where we're now fiercely working, and this is not you read all of this, working on a system, on a broader lab, hybrid and physical, where we start collaboration with all the healthcare organizations, and these are the ones already admitted that they will join us probably in January of the next year. We don't know how healthcare will look like in 15 years. But also, as Toon mentioned, the average time it takes from the idea to realization is about 7 years in healthcare, if not more. So I'd like to ask you again, please be open for what's coming up. Have an open acceptance for that. Step out of the line and think in a different form, in a different way, because I know what the solution is not. The solution is not delivering more healthcare. The solution is delivering more health. If you want to know more about that, find me on LinkedIn, scan the QR code, or ask me afterwards, send me a message. And I would like to wrap up with a tongue-in-cheek to that campaign of Apple about Think Differently, but now from a different perspective.
Here's to the biological ones, the wild ones, the creatures, the carbon-based, the extraordinary hidden in plain sight. They're not fond of stagnation, and they have no respect for shortcuts. You can ignore them, study them, glorify or vilify them. About the only thing you can't do is disagree with them. Because they are brilliant, they have cultivated the most elegant solutions. They optimize. They are tuned to their environment. Maybe they have to be biological. Where else does one find systems, processes, and strategies proven over billions of years? A curriculum around every corner. Answers to complex challenges in a single organism. While some see them as the biological ones, we see technology and design. We see inspiration and insight for today's innovators and tomorrow's too. Because the ones who evolved to thrive for eons are the ones who can teach us to do the same.
Thank you very much.